My name is Biu Sikivou. I'm the ophthalmologist in charge of the diabetes eye clinic run by the Pacific Eye Institute and Fred Hollows, New Zealand. We are all aware that the prevalence of diabetes is increasing. So if we have high prevalence of diabetes, then of course we expect a high rate of people with diabetic eye disease. At the moment we are conducting services in the main hospital in Fiji at the CWM hospital, and also doing outreach to 9 different health care locations in the Central Division. Hollows, New Zealand came in 2002. That's when everything just started and got rolling, when we developed our first national eye care strategic plan. And Hollows, New Zealand was sending me to so many meetings to go abroad. It just sort of broadened my view on, learn from other countries. One of the big problems here is patient coming to Suva, to the main clinic, transport problems, and people with diabetic retinopathy are visually impaired. They need, another person to bring them. So this is really good that we are taking the services closer to where they are. Because in Fiji, getting from one place to another is quite difficult. So if you can provide everything in one go, refraction, glasses, cataract surgery, diabetes assessment, that would be ideal for the patient. Trying to create awareness not only for the public, but also for the healthcare providers, that they should know that all people with diabetes need to have their eye examined. Because that was one of the main findings of the eye health survey, that they found that 40% of people 40 years and above had diabetes, and of those 60% were previously undiagnosed. And 1/3 of those that had severe diabetic retinopathy had not had any previous eye examination. It's not only the laser treatment, because the laser treatment usually does not improve vision. It just reduces their chances of getting further vision loss down the line, because the main treatment is still the control of their blood sugar level. Getting people to change their eating habits, it's not easy. I find most of our patients here are Indo-Fijians, and the staple diet is rice and roti. Both are very high in glycemic index. You can't just tell them, not to eat this, or reduce your intake of this high glycemic index food. We have screeners trained, we have doctors trained in diabetes, and we have a separate building now, and we run services daily, 5 days a week, and 2 to 3 times a week doing outreach. Training Pacific Island people, nurses and doctors, they've seen how we're running our diabetes eye program here, and they want something like that to be done in their own countries, because they know what the prevalence rate of diabetes is like in their country, and nothing is done about people with diabetic retinopathy. Most of them don't have the right infrastructure, don't have people already trained on the ground, and don't have any equipment. That's something that keeps me going, to try and help these people to, prevent them from getting to a stage where they will totally lose their vision. I'm really happy of the training that has started here, and I'm sure that will continue to help, because people that are being trained here will go back now and try to change things that are happening back home.